Hi Anna.
Hey Marina.
How are you?
I'm good, I'm good.
So we've been seeing a lot of TMJ work from you recently, a lot of information coming out about it. Are you doing only TMJs at the moment, or what is the reason that we're seeing so many TMJs?
Yeah, you're right. There is a lot. It's not everything that I do, but I do spend probably the majority of my caseload doing TMJ, and then obviously related things, so the neck. It's a pretty big area, really, if people, if you start to ask the right questions. I think it's a relatively unknown area for physio. There's a lot of people that don't know physio can help, and so I do get a lot of surprised faces when we say that.
When you find that to be the problem.
Yeah, that's right, and when they find that physio can help. So it's.
So how did you decide to move your focus to TMJs?
Purely, I just really enjoy the area. I think that the TMJ, it's quite a complex sort of joint in itself. So that the joint itself is quite complex, but more so the conditions that we see with it, that they are quite complex. And so I really enjoy fitting that puzzle together and working out, because it's a very broad range of conditions that may be involved. So piecing that all together and then working out, from our point of view, how we can best help people. I really enjoy that challenge. It's quite interesting in that regard for me.
I enjoy treating necks, and I often see that my neck patients have a bit of a TMJ component.
Yeah, absolutely.
So when you treat TMJs, do you focus purely on TMJ, or?
No, never. Personally, I never treat the TMJ itself. It goes hand in hand with the neck, and which is probably why you see a lot as well, because the position, posture of the cervical spine will directly affect the position of the temporomandibular joint. Vice versa as well. So very rarely do you have one without the other. My treatment will always generally involve both. And I think it's really good practice for physios in general, if they are treating somebody that just comes in with a sore or stiff neck, to just ask some questions to check whether they do have any, pain, stiffness or anything in the jaw.
Or tend to clench their jaws.
Absolutely, clenching, grinding. If you've got someone who's in a very stressful situation or is a bit of an anxious person, again, we tend to bring shoulders up, which goes further up, so into the neck and the jaw.
And it doesn't even have to be stressful situations, but just force of habit kind of things.
Yeah, absolutely.
Sitting in the office, sitting too far forward.
Yeah, exactly. People that do a lot of driving, will often find that their shoulders sort of come up. So, there's all those sort of things to look out for, and it's probably something that physios in general can ask a bit more about, just to make sure that we're
get
checking
the complete picture.
Yeah, that's it. Yep.
And what kind of things could patients expect when they come into the room with you? Is it something scary?
No, not at all. It's like no other physio session. It's no different. It's just a different area that people aren't familiar with physios being around their face and their mouth. But no, it's no different. Look, I go through posture, have a look at the position of their cervical spine, their shoulders, their head. Is their chin poked forward a lot? And then assessing muscles, so muscles up the top of the head, down through the mouth, and that's both external and inside the mouth as well.
I think that could sometimes, I find with my patients, it's very uncomfortable.
Yeah, it can be, yeah, absolutely.
But they find great relief with it.
Yes, that's right.
I think it's definitely worth, even though it's not something we're used to, it's definitely worth sitting through it.
It is, yeah, and I mean, it's just about giving the person the information. So I always will generally say, this may be a bit uncomfortable initially, and sometimes people will be a little bit more uncomfortable immediately following. But what they will then find is that the next morning or the next day they will wake up feeling better, or later that day they will feel better. So I think it's just being really honest with people. But certainly the muscles inside the mouth can get very tight without people ever knowing. And so it is like no other tight muscle in the body. We push on it, it can be sore. You think if you've got a really sore, tight quad, thigh muscle, if you get someone really pushing on that, that's going to be sore. But the benefit is worth it. But it is an area, though, that we do work quite gently with because it's easy to set people off.
A short period of time.
Yeah, that's right. Yeah, short period of time and quite gentle. It's not like a deep tissue. You nowhere near that sort of force. So,
And have you found good results with what you've been doing?
Yes,
How long
definitely.
has it been that you've been busy with this?
It's been over a year, probably about a year now that I've sort of been TMJ focused, I suppose. And yes, the answer is yes. You do get good results because neck pain, tight muscles, we clench, so everything gets tight. Headaches, we can help with that through a number of things. So that's our role, and then but also recognising that dentists will probably have their role too. So if you've got somebody that is grinding their teeth at night, maybe physio does their part, and then the dental part is perhaps a splint or something like that. So because it's quite a complex condition and there's often many different things involved, it is working with some other professionals as well to get sort of the best results.
And that's again nice, getting that teamwork in and seeing, for example, if sending them to the gym and getting some exercise.
Yeah, that's right. Yeah.
If that also can contribute, again, the teamwork and going dentist, physio, exercise physiologist, coach if you need to.
Yeah, absolutely. Yeah, there's a few different things that we can look at because it's looking at the whole person rather than just one tiny little isolated part. Look at the big picture, and typically as in it's like the neck as well. If you can help address their other, sort of things and get them feeling better all round, that probably is, the best thing for the person.
And what I'm interested in, do you have specific exercises you would give a person with a TMJ condition?
It probably overlaps a fair bit with the neck as well because, I treat the jaw, but I also treat the neck as well. So I'll let you go through the neck ones. So jaw-specific ones, I suppose, it depends what we're trying to do. So if you need strengthening, we can strengthen through the jaw, through resisted, exercises. Albeit it's a lot gentler than thinking you're going out into the gym. But that's just a different way of looking at it. So we can do resisted movements. Also, things like self-massage as well. But certainly I do a lot of neck position and posture. So your deep neck flexors, your cervical extensors, which you want to run through. Does that overlap with how you treat a neck?
Yeah, definitely. I think with my TMJs, things like, or neck patients, it's often simple things like when they're in the gym, putting the neck in the right position, even though that is not what you're working on, even a patient who's a power lifter, if their neck is not in the right position, you can often get a lot of complications from there.
Yeah, absolutely. And that may or may not happen straight away. It might, but probably for the majority of cases. So it comes down the track. So it's after years of doing that. And that's probably what I see a lot with TMJ is that, someone will come to you and you'll say, okay, so when did you sort of start having pain? And it might be 5-10 years ago. That's not uncommon. And I think what I see with the neck, if you agree, is that that's the same sort of thing. Someone will come and they'll say, my neck's always a bit stiff, I've always got some niggly headaches, all of that sort of thing.
I've had neck pain all my life, that kind of thing, which is obviously not the truth, but
to some extent, though, it can be, you know, years and years. So, and that's where I think you said, you know, that's where treating the little things, making small little adjustments to how you hold yourself and how you move, can have an overall fairly big impact over some time.
And I think we also want to create that place where we can teach our patients to take care of themselves, to deal with the issue.
Yeah, that's right.
And teach them little things that they can use in their everyday lives to make it so they don't have to run to the physio every 2 or 3 weeks.
Yes, exactly.
So for me, with a neck patient, I would always teach them to just do big shoulder rolls and make it a part of your day. Every time you go to the bathroom, you've got the time to sit there. So just sit and roll your shoulders a few times.
Absolutely.
Instead of being up there. And then simple stretches like stretching to the side for 30 seconds. It's something you can do while you wait for the kettle to boil, or you have to find the things, because a lot of people say, I don't have the time to do the exercise.
That's right,
Whereas I feel it's possible to build it into your day. And then one of my things that I teach most people, or at least all my neck patients, is to activate the deep neck flexors and get the neck into the correct position. And I think with your TMJs, it probably goes hand in hand as well.
Absolutely, because I mean, you know, I can do all the work that I like around the jaw joint itself, but if the neck isn't in a good position, or there are tight end or weak muscles in the neck, then that's going to have a direct effect. So that's why I say you can't treat one without treating the other in most cases. So certainly, yes, those little adjustments, those little things that they can do differently.
When you sit at the computer, not being there and just sitting upright.
Yeah, and that's something that, you know, whether it's technology, whether we're all a little bit more sedentary, sitting down, more driving, etc., that chin poke, you know, it does add up. You think it's quite small, and it is quite small, but the effect that can have,
and the amount of what you do.
Absolutely, you know, headaches as well. Headaches are such a common thing, I think, when you actually start talking to people. There are a lot of people that put up with these niggly headaches. Now, obviously, there can be a whole number of reasons for headaches, but one of them can be jaw, neck. So if we can help with the position and movement and control through those areas, you can have fairly big effect on improving headaches.
Because if you just correct that position of the neck, it just takes the strain off those back muscles, which often has a big effect on your headaches as well.
Yeah, absolutely. And I think people don't realise how tight they can get through the neck and the head until we start to, you know, poke around and show them.
And then, do you ever see kids with this problem? Have you?
I haven't sort of directly. I think, and this is why I think it comes down to, there is a big component of TMJ, which is your sort of psychosocial. So whether that's, you know, occupation, sitting, whether that's high stress, so, you know, which we don't typically see in kids. Probably more in kids, it would be problems related to direct trauma. So a blow, you know, at football or sport or what have you. Not that it can't happen by any means, but no, nowhere near as common.
Nowhere near as common as we see neck problems in kids now.
Yeah, well, that's right. And will we see more of it now with phones, devices? You're looking down, you're always forward, hunched over, playing. Perhaps that is something we will start to see more of.
And hopefully not. Hopefully we can get that education through of rather lifting your screen up.
Yeah, that's right. And I think just education in general, you know, I think it's really interesting the number of people you get maybe in, you know, from 50 onwards that come in with a problem anywhere in the body, and they say, if only I had have known when I was younger. I wouldn't have done that, or do you know? So I think the more we can educate people in general and sort of greater society and talk about things, then probably the better off, I imagine. But, you know, holistic general health, I think, probably needs to lift as well for people. We spend an awful lot of time sitting down and not moving, and we know the effect that can have down the track. So, are there any for you? So, like, if someone comes to you with, let's say, relatively for them high or significant neck pain, obviously you'll do your course of treatment, but what would be your sort of top couple of tips that you could say to them? All right, well, you're in pain now. This is what I want you to do. Like, what would be your sort of always go-tos to help them in the very short term, immediate?
I usually find that little bit of hands-on is necessary. Just getting some of those muscles to be released. And then, like I've said earlier, making little changes in your day, your shoulder rolls, your neck stretch to the side, both sides. And I like the turning 45 degrees, dropping the chin to the chest, because that stretches the muscles in the back there. So those are usually my favorites. And then, of course, deep neck flexors. That's very important. And in case of the TMJ. Otherwise, we would probably keep chatting for the rest of the day.
I think for people, generally people that come and see me, like, they are in pain. You know, it is something that they're really quite sore. Maybe they can't eat, you know, firm food, so they're having to eat mushy things, or maybe, you know, talking is hard. So these things are quite, like, have quite a big impact on their day-to-day sort of thing. So they're in pain. We need to sort of get on top of that. A couple of really simple ones, like heat pack for the neck, because 9 out of 10 there is going to be some tight muscles through the neck, but also some ice cubes in the mouth. So that it's quite hard to put heat inside the mouth. So that heat, the ice cubes can just settle the muscles down a little bit. Also, if there is any inflammation, obviously the ice can sort of help with that. So, and it's an easy thing for people to do. Most people in our climate don't mind, you know, some ice cubes, and so just popping a couple in the mouth can be quite useful.
And how often do you do that?
All depends on sort of time availability, but, you know, if you're sitting at work in an office, you can do that 2-3 times a day.
So 2-3 times a day would be ideal.
Absolutely. Really easy. And then, if they're getting sort of very tight through here, you can do some simple self-massage, you know, just along the jaw up through here. You know, that can be quite good as well, because that can have a significant impact on your pain. So a couple of really quick and easy ones.
That's very interesting. It was nice chatting to you.
Yes. Probably some couple of areas that we could go on about for a long time, because, you know, there's a lot to them. There's a lot of people with them. And, we're probably seeing a lot more of it.
Well, it's great to have someone in the area that enjoys it.
Yes.
So let's see how we go.
Yeah, absolutely. We'll talk more.
Absolutely.